Hello, my name is Landon Morrison. I'm a psychiatric nurse practitioner, which means that I can prescribe medications for psychiatric purposes, and also do counseling and therapy. Today, we're going to have about 45 minutes together. I'm going to give you a little bit of time in the beginning to talk about what's going on and what's bothering you the most. I'm going to move from there to some more specific questions. And then finally, we'll talk about what to do next, whether that's medications or types of therapy or other coping skills that we might talk about. So why don't you go ahead and kind of give me a good idea of what has brought you here today and how you think I might be able to help you.
Sure. So it's nice to meet you. My name is Latala, and I actually really happy I had a baby about 2 years ago. So she'll be 2 in December. And while, I love being a mom and motherhood is great, sometimes I just have lots of issues with being anxious and just worrying about absolutely everything and what could possibly happen. And I guess I'm here today to try and figure out some coping methods. How do I maybe calm down a bit and take life as it comes and not be so worried and anxious about everything.
Okay, cool. Well, congrats on your child. Did you say it's a girl?
It's a girl. Yep, Ellie.
Yeah. And what, Ellie?
Yeah, well, her name's Elliot, but we call her Ellie for short.
Nice. That's a really pretty name. So about how long have you been feeling this level of anxiety?
Well, to a certain extent, probably since she was born. We brought her home from the hospital, but I think, as she gets sick sometimes at daycare and, worrying about her being on time as far as milestones and things like that, can definitely cause me some worry and anxiousness.
Yeah, I definitely understand that. I've been there myself, especially my wife too. But it can be really hard because you care about them and you want them to be okay and to be the best they can be. So what are some things you do right now to kind of try to help yourself calm down?
Well, I kind of try and put myself in a calming headspace. I took a seminar like 5 years ago on mindfulness. So I try some deep breathing techniques sometimes in the morning if I do find myself starting to spiral a little bit. I kind of try and take more time for myself. And my husband's really good about that. He'll make sure that I do have time. It doesn't exactly stop the worrying, but, I can kind of calm down a little bit. But yeah, and, try to, which is easier said than done, but just try to realize that things happen that are things that are beyond my control. And, you can't control everything. But like I said, easier said than done.
Yeah. Is it affecting your sleep at all?
Some. I think it's the fact too that because our daughter has just, been sick a lot, like she sleeps in the bed with us a lot. It's terrible. So that's definitely part of it. But no, as far as like the actual worry and anxiousness, no, I don't think it affects my sleep that much.
Okay. Well, I love that you're doing breathing exercises already. If you don't mind me asking, what kind of breathing exercise do you do?
So like I breathe in really deep and then take a measured breath, almost like breathing through a straw, and completely exhale and then do it again. And I just kind of do it until I feel very calm, and it actually helps a lot.
Yeah, you probably learned this in your seminar, but they say that it's a way of your body telling your mind that everything's okay, because typically if our breath is slower, it means things are okay around us, and kind of gets you out of that fight or flight mode. Another one that I like, and you may have heard this before too, but it's called box breathing. Have you heard of that one?
I haven't.
Okay. So it's real simple. You just on an inhale, you inhale through your nose and you count to 4, and then at the top of that, you hold you hold it at the top of that breath for a count to 4, and then you let that out for a count to 4, and then you hold it at the bottom for a count to 4. So it kind of looks like a box. So you're inhaling, holding, exhaling, holding. And you just kind of do that until your body starts to feel a little more calm. So that's another one that you could try. That it's normal and it happens and it does get better. And I hope and probably think that you've heard that before, but you're not alone in that struggle. Having a young kid is a difficult task. Um, so anyway, is that your anxiety something that you would be interested in attempting a medication? Do you feel like it's to that extent?
Well, I mean, I've always tried to stay away from medication if I can and try
Yeah,
and manage things like, which better said than done. I do not exercise, but I know exercise is a really good way to
yeah,
try and let out, a lot of worry. So I've been trying to get back into that.
nice.
But yeah, if I can, I like to try and kind of work on myself. If I can avoid medication, I will.
Yeah,
Um, so yeah, I mean, at this point, I probably would not be looking to
yeah,
um, use medication, but maybe more, coping methods and skills that I
sure.
can learn that'll help.
Yeah, so I completely agree with that and would definitely say try other things prior to medication. And exercise is the best medication that you could ever do. Um,
Everyone tells me that. It must be true.
yeah, it's especially for anxiety, just getting out that restless energy can be so helpful to kind of calm your body throughout the rest of the day. That's one thing. And then, as far as counseling, obviously, I think together with your husband would be great. But if it's still something that you personally are struggling with, even if you just find somebody to kind of talk to and bounce things off of, like you're doing today, it's going to be helpful in that way. Just because you can then teach him. I'm sure he's more open to you than he would be to some, counselor that he doesn't know. So yeah, I would definitely recommend exercise daily if possible. I know that can be hard with a kid, but even if it's just a brisk walk, they studies have shown that that's effective even as much as like jogging, or something like that. So it doesn't have to be anything crazy. You don't have to run a marathon. Just get out there for 20 or 30 minutes and get your heart rate up, and breathe in some fresh air, and I think that'll make a big difference too.
Okay, thank you.
Yeah, absolutely. So when I was a registered nurse in a hospital for about 5 years, I realized through all my patient encounters that mental health was as a big a deal and as important as physical health for the good of these people's lives. And so I started to learn that I really enjoyed sitting down and talking to people even more than I enjoyed the medical part of things. And especially being in the hospital, I realized that people's health was getting better more often and quicker if they were in a better mental space to do so. So that's what led me to psychiatry in general. And especially, now that the COVID pandemic has occurred, and that took a large toll on a lot of people's mental health, being more isolated, being at home more often, not around people in social settings as often, not being able to see people's faces due to the mask. All of those things have contributed to mental health getting worse as a whole. And so, coming to see somebody like me can be very intimidating, but it can be helpful in the sense of just being able to talk to somebody about how you're feeling. There's a lot of times when people feel like they can't talk to their own family members because of maybe like judgment or maybe just history or whatever it might be. And it can be really helpful just to have somebody who doesn't know you or your family from an outside perspective to talk about how you've been feeling and how you're doing overall. Um, I think that medications are appropriate in some situations. And I think there's a lot of other things people can do as well to help with their mental health. And just talking to somebody in a counseling type setting, I think is so therapeutic to a lot of people. Just having someone to bounce those feelings off of and really just pour out what's going on. So I can help provide that space to listen and be supportive in that way too. And I can also try to help teach coping skills, whether that be exercise techniques or breathing techniques or just different way of thinking about things. So I definitely encourage anybody out there who is on the fence about getting help. I think the biggest thing that I would say is that it can't hurt you to come and talk to somebody, whether it's me or somebody else in the mental health field. There's not going to be any serious side effects from coming to talk to somebody. And then you and whoever that might be who is attempting to help you can make the decision from there about whether or not you want to try any medication or coping skill or something like that. So definitely encourage you, if you're on the fence, to come on in, whether it's to me or to somebody else, and just give it a try.